My presentation seeks to achieve 4 objectives. 1, I will provide you the latest information regarding the status of the COVID-19 outbreak. 2, I will share with you factors associated with this disease. Thirdly, I will share with you what is being done here in the Federation regarding preparedness and response. And then, most importantly, I will share recommendations regarding what individuals in our general population can do to prevent this disease. So let's look at the status of the COVID-19 outbreak. The new coronavirus, or coronavirus disease 2019, continues to spread. As of today, March the 2nd, 2020, over 88,000 persons have been diagnosed with this new coronavirus, or COVID-19, in over 60 countries. COVID-19 has impacted all continents except Antarctica. The novel coronavirus has killed over 3,000 persons worldwide. In the region of the Americas, 8 countries have reported cases, including the United States of America, with 62 cases and 2 deaths reported in the Washington state area. And the WHO tells us that there is local transmission in the United States. We have Canada reporting 19 cases, and Canada also has local transmission of this disease. Brazil reported 2 cases, Mexico reported 2 cases, Ecuador reported 6 cases, and closer home, we have the Dominican Republic reporting 3 cases. In our backyard, we have St. Martin reporting 2 cases and St. Bart's reporting 1 case. The World Health Organization has assessed the risk of this disease to the world as very high. This outbreak has the potential of becoming a pandemic. The risk of the virus reaching the Federation is very high. Now, what are some of the factors associated with COVID-19? More particularly, what's the epidemiological data we have regarding this disease? The World Health Organization is working closely with clinicians providing care to patients with COVID-19 in China and across the world. And so they have shared the following information. COVID-19 is spread mainly via respiratory droplets, and that's respiratory droplets laden with the virus from infected persons who cough and sneeze. It may already be spread. It may also be spread by touching contaminated surfaces. Most commonly reported symptoms included fever, dry cough, shortness of breath. Some other symptoms include runny nose, muscle pains and aches, conjunctivitis, that's inflammation of the lining of your eye, and some experience vomiting and diarrhea. The incubation period was originally thought to be 14 days, but it can be as long as 24 days. Now, majority of the patients with COVID-19 are adults. In China, only 2% of the patients were below the age of 20 years. In other words, this disease is not prevalent among children. And those children who are affected, they experience a mild form of the disease. Approximately 80% of the patients who are impacted by this disease experience mild illness, with a clinical course of about 2 weeks. Approximately 14% of those impacted by this infection experience severe disease requiring hospitalization. And the clinical course of such persons can be as long as 6 weeks. About 5% of the cases will require intensive care unit admission and sometimes mechanical ventilation. Illness severity is associated with age. In other words, those persons who are 80 years and over are particularly at risk for severe illness. And also persons with coexisting medical conditions like diabetes, hypertension, heart disease, and chronic lung conditions like asthma. So what are we doing here in St. Kitts and Nevis in terms of preparedness and response? The Ministry of Health continues to inform and update the public about this outbreak. 4 media releases have been disseminated so far. We've also disseminated a travel advisory. This was first issued on February the 1st, and it was reissued on February the 20th. And as our permanent secretary said, we hosted our first press conference here 1 month ago on February the 3rd, 2020, and now we are here again. Continuing medical education sessions on the virus were delivered to doctors and nurses in St. Kitts and in Nevis, and this will be continuing as we learn more about the disease. This session took place in St. Kitts on January the 29th, and the session in Nevis took place on February the 3rd. The Ministry of Health is or has updated its St. Kitts and Nevis National Pandemic Influenza and Virus Preparedness Plan. All frontline port workers were formally sensitized to COVID-19 and the new measures at the airport on January the 24th, 2020 at Nemo. The Ministry of Health has strengthened surveillance at all ports of entry and airports. When I say all ports of entry, I mean Port Zante, Christophe Harbour, and New Guinea. All international flights and flights from regional hubs are being monitored. And I'm referring to flights coming in from Antigua, St. Martin, and Puerto Rico. Accurate completion of question 17 of the St. Kitts and Nevis immigration form is now an absolute requirement by immigration for entry into the Federation. All incoming travelers from China, Hong Kong, Macau, Singapore, South Korea, Japan, Thailand, Vietnam, and Italy, and Iran must be directed to the health desk to provide information regarding details of travel history, history of exposure to COVID-19, their health status, and contact information. The health team at the airport utilizes a screening tool to evaluate these incoming air travelers to determine their risk to COVID-19. And depending on their risk, they are either allowed normal entry, they may be monitored by the public health team, or such persons may be quarantined. Please note that you will not find thermal scanning taking place at the R.L. Bratcher International Airport because, based on the latest evidence or science, the use of thermal scanning or temperature guns is not an effective way to detect COVID-19 cases. Also, if you are an incoming traveler and you are coming from a territory that's not deemed a hotspot, you may not interact with our health desk. The National International Health Regulations Committee within the Federal Office of the Ministry of Health continues to monitor this outbreak daily. I want to use this forum to thank publicly Dr. Bishara Saheli, our internal medicine specialist at the JNF General Hospital, who conducted a very critical training session for our response teams at the JNF General Hospital and Alexandra Hospital on Monday, February the 24th, 2020. This was a success. The Ministry of Health will be conducting another training session for a cadre of contact tracers tomorrow morning, March the 3rd, 2020. Contact tracing is a necessary step in terms of containing an outbreak of an infectious disease. So in essence, the Ministry of Health is in a state of readiness for our first case. Now let me share some information regarding port surveillance. A total of 63 incoming air travelers have already been screened by the health desk at the R.L. Bradshaw International Airport with the following outcomes. 3 asymptomatic persons have been quarantined at home. 6 asymptomatic persons have been quarantined at tourist facilities, and 50 persons are being monitored daily by the public health team. I also want to add that 2 incoming air travelers consented to testing for the COVID-19 virus because they were coming from countries with local transmission of this disease. I also want to underscore that these individuals tested negative for COVID-19. Now, the private sector, particularly Next Generation Medical Laboratory, is providing this local testing capability. I also want to inform the public that the Ministry of Health recently procured a gene expert machine, and our staff is presently being trained to use this machine, and so we will soon have local testing capabilities in our public sector, particularly at our JNF General Hospital, and this is a priority for the Ministry of Health. Now, I want us all to listen carefully because this section of my presentation is the most important aspect of it. How can individuals best prepare themselves for this impending outbreak? How can you and I protect ourselves from this SARS-CoV-2 virus or COVID-19 infection? Well, we can wash our hands thoroughly with soap and water for at least 20 seconds after touching contaminated surfaces. You can also use 60% alcohol-based hand sanitizers. So hand hygiene is very, very important. Actually, the evidence tells us that this is the best weapon against this virus, hand hygiene, even more so than using a face mask. Secondly, we want to recommend that you avoid close contact with anyone with cold or flu symptoms. In other words, you are to maintain a safe distance, 1 meter or 2. Remain 1 meter or 2 from persons who are visibly coughing and sneezing. Persons with respiratory symptoms should cover their nose and mouth when coughing and sneezing, either with a tissue that's disposable or coughing in your flexed elbow. And it's important that those who are exhibiting such symptoms, that they should remain at home. In terms of the use of surgical masks as face masks, it is recommended that persons with respiratory symptoms, they are the ones who should wear these surgical or face masks. You need to avoid shaking hands. Let me repeat that. In the event that the virus is here or gets here, you need to avoid shaking hands. We need to be innovative and use alternative means of greeting our friends and loved ones. Use disposable gloves when handling contaminated surfaces. Avoid touching your face, your eyes, nose, mouth. We subconsciously do this, and so we need to start practicing from now. Let me repeat. We need to intentionally avoid touching our face, our eyes, nose, and mouth. Just a little word on masks. Face masks are effective only when used in combination with frequent hand cleaning with soap and water or an alcohol-based hand rub. And so these are the measures that you and I can take to protect ourselves against this virus. COVID-19 is spreading rapidly across the globe. The risk of this virus to our federation is very high. However, our health system has the capacity to detect, contain, and manage this coronavirus disease outbreak. I think I should repeat. Our health system has the capacity to detect, contain, and manage this coronavirus disease outbreak. The Ministry of Health remains in close collaboration with the Caribbean Public Health Agency and our regional and international partners. We are following this outbreak very closely, and the public will be updated as often as required. I thank you.